An NHS Trust is part of the National Health Service of England and the UK. It's the government-funded healthcare system. Here in Leeds, we've got the Leeds Ways. There's sort of 5 core principles the Trust has. And at the centre of that, the main principle is being patient-centred and very much sort of patient care. So we always had a view of, if we're going to do something, does it improve the patient journey? Really simplistic things. You get rid of the radiation prescription piece of paper, well, you're never going to lose it again, are you? It's faster. People can do things quicker. One person does one thing, a notification in MOSAIQ or SmartClinic immediately tells you to do the next thing, so you reduce lags in it. And that means that some of our patients now go from referral through preparation and treatment in as little as 4 hours. And that's been a key driver in some of our patients who need really, really urgent radiotherapy.
Smart boards are a tool that allow us to monitor what work needs doing. So, for example, we have set up a referral smart board that monitors for booking forms being completed. This will allow us to remove a report that we're currently reliant on. The staff will see when a referral pops up on the smart board. They'll be able to do the necessary actions required to set the booking process going. The forms will just drop off the smart board and they'll know that everything's been done, and they can monitor just how much work is coming in and what still needs doing.
Here in Leeds, we get, on average, between 30 and 40 referrals for radiotherapy every single day. I think the board monitoring has given us real confidence, actually, that our systems here in Leeds were already good. This has given us that extra assurance that we are delivering the care that we want to, we are delivering in a timely manner.
A lot of the purpose of bringing SmartClinic to kind of Gamma Knife unit was to help with a lot of compliance, make sure that we're kind of like all the data is kind of up to date and safe. In terms of how Leeds is set up, the Leeds Gamma Knife unit, the team is quite spread out. We'll have one team that's upstairs with the patient's brain fitting, and we'll have the physics team waiting for the information in the actual Gamma Knife unit. SmartClinic has actually been really important in passing information really quickly, like seamlessly between the teams. Just before we kind of fit the actual stereotactic frame, we obviously have questions we need to ask the patients. There's things that we need to kind of pass to them as well. SmartClinic is a way where we can actually do it in front of the patient while we're there in the setting. It gives them an opportunity to ask any last minute questions, get any last minute information off of us. It's not something that's just in designated areas. But the reason we chose SmartClinic over anything else was that we can actually do it on the iPad in front of the patients. I mean, the whole kind of purpose of bringing SmartClinic for me was to actually so I can spend more time with the patient. The patients do love the fact that we bring technology into it. When we kind of like they come in for the treatment, the radiotherapy Gamma Knife, it's so technology orientated, it's so high tech to them. The fact that we are using iPads, we're using SmartClinic, it seems very high tech, it seems up to date. They liked the fact that we bring technology.
Prior to using SmartClinic, we had a lot of administrative tasks that were time consuming. Now that we've got SmartClinic, admin clerks only have to deal with one form and the consequent volume of work from that. So if you like, SmartClinic in essence has managed to quarter the amount of time that we need to spend doing tasks where we can be doing other things.
It's been great to see that SmartClinic came from conceptually, wireframe ideas, what could it do, where is it going to go, and we can really now see the benefit of that software. Here in Leeds, we've had immediate benefit, and benefits are growing all the time. Small, iterative workflow enhancements that actually mean that somebody has 2 less clicks or something like that. But I think, to me, it's been the journey we've gone on together, and I don't really sort of feel that we've even kind of got halfway along that journey yet. We're at the start. We really have had a fantastic time developing this, implementing it, and now it's let's see how far we can go with it.